Thank you very much for joining us. Hello and welcome to the Bit by Bit webinar. Today's session is going to focus on the healthcare industry and on enhancing patient care and efficiency through the power of fax. My name is Peter Korn. I'm a RightFax account rep here at Bit by Bit. Also speaking today will be Scott Leahy, another senior account executive and the head of our branch office in Massachusetts. To round out the Bit by Bit team today, we have senior RightFax engineer Bill Venezia, who's also our help desk manager and overall RightFax guru. Bill's going to be available to answer any technical questions you may have. The session is scheduled for 30 minutes, and in this time, we plan to cover a brief intro to Bit by Bit, common business challenges our healthcare clients have shared with us, the power of integrating your EMR applications in with RightFax and how it will streamline your day-to-day workflow. We're going to touch on some new modules that will help you enhance your security and make you more compliant with regulations like HIPPA. We'll chat about fax in the age of COVID, and then we're going to take some questions. To keep this moving quickly, we're going to start everyone in listen-only mode. If you have any questions as we proceed, please type them into the chat window. We'll get to these at the end of the session. So let's jump right into the content. Bit by Bit is a full-service technology firm. We take pride in the term solution provider because we're here to make our clients more productive. We've been in business for over 30 years. Our physical headquarters are in New York City, but we also have offices in Arizona, Oregon, New Jersey, Massachusetts, Texas, and Vermont. Currently, we're all working from home, so I know we can extend that location list to include at least Connecticut, probably a few additional states as well. In 2016, we opened up our first international office, and now we have level 1, 2, and 3 engineers in Indonesia to help service our clients in other time zones and for emergencies after hours. Fax. We've been selling and supporting RightFax for over 30 years, in short, since the infancy of fax technology, all the way back when RightFax ran on the OS/2 operating system predating Windows. There is very little about RightFax we haven't seen or worked with before. We can offer both on-premise and cloud-based versions of RightFax. We'll touch on that later. And we're also a certified RightFax training center. As for managed services, for many of our small to mid-sized clients, we offer a fully managed IT support service. We assist our MSP clients with everything from day-to-day troubleshooting to long-term big-picture strategic planning. We can host and support the applications, servers, desktops, backups, and more. For most of these MSP clients, we provide end-to-end support, which is available to them 24/7, 365. We are their help desk. We can also provide redundancy and business continuity beyond what most small to medium-sized businesses would generally be able to do for themselves. Cloud solutions. We bring both public and private cloud solution offerings to our clients. Some of the most popular cloud solutions are Office 365, hosted phone systems, web hosting, and our popular virtual office. We also host and manage servers for our clients in our secure data center. With COVID keeping workers at home, cloud solutions went from being convenient to being critical. Bit by Bit can also help you determine which applications can be moved to the cloud, and we can assist with a smooth transition of your data. Information exchange. Hospitals depend on electronic communications. I don't have to tell you. Faxes, emails, online collaboration. We can help you do all of this more efficiently. So please reach out to us after this webinar if you want to hear more about eliminating manual data entry, saving time processing forms and applications, routing documents to desired recipients automatically based on their content and on business rules, and more. Application development. App dev has always been a cornerstone of the Bit by Bit solution suite. Be it the development of a custom application, the customization of RightFax, or helping to automate repeatable tasks, our app dev team is deep and experienced, and we're here to help. And cybersecurity. In recent years, Bit by Bit has added a lot of tools to our cybersecurity offerings. While most, if not all of you, have strong security in place, contact us and we can help you identify potential holes in your security fabric. We can discuss things like penetration testing of the existing environment, managed detection and response technology, security awareness training for your customers and users, dark web monitoring, and more. So with so much time-sensitive, mission-critical info being exchanged by organizations like yours, the challenges to do that securely and efficiently can be daunting. We work with a lot of hospitals, it's our biggest vertical, and we have found a lot of them share the same challenges. One big issue is trying to complete complex processes or workflows with a disparate set of tools. We find unless there is very tight integration, anytime you have several applications trying to talk to one another, you're really depending on a lot of things to go right. It's important to develop systems with fewer tools that are more highly integrated. The next challenge, which is a common one, is speed. When it comes to patient records, speed is critical. As with any operation, pun intended, cost is always an important consideration. IT directors are tasked with trying to solve these difficult business problems, and they often have to do so on a very limited budget. Hospitals also need to face the challenges above, while at the same time being more compliant with regulatory mandates like HIPPA, SOX, PCI, DSS, Sarbanes-Oxley, and more. And with more automation, regulation and oversight being added in healthcare, workflow can get very complex and involved. So I think probably the biggest challenge we're hearing is how to simplify the process of exchanging information. So the hospitals we work with are sending hundreds and thousands of pages a day. Sometimes that number gets into the millions. These faxes range from patient records and claims to billing and purchasing. And as I said a minute ago, the real challenge is to do this both efficiently and securely. Some of the most popular use cases we're seeing in healthcare are viewing and editing, signing, exchange of patient records, billing, claims processing, benefits, sharing of lab results, procurement, referrals, and more. So now that we've touched on some of the challenges we know you to face, I'm going to tag in my colleague Scott Leahy, who can dig into how you can use some new RightFax modules and tight integrations with EMRs to make this information exchange more efficient and more secure. Scott? Scott, I think you may need to enter your PIN number.